Welcome, Dr. Mark Brainard, President of Delaware Technical and Community College. Happy New Year.
Good morning.
I thought that before we do a sort of a check back on how the campuses are doing during the pandemic, we could talk a little bit about community college. Our new First Lady is a passionate advocate
Yes.
for community college. And I wondered how many people know that you actually began your career right at Del Tech. Can you reflect on that?
When I reflect back to my first days at Delaware Tech, I reflect back first as a student. When I took a break after high school, went to work, and then decided, I really did have to go to college if I was going to accomplish anything. So I found myself at the Stanton campus of Delaware Tech, and that's really the 2 years of my life that I think prepared me for everything and anything I wanted to do, whether it was to make a career in public service or go to law school. It really was those foundational years that at a community college that did that for me. So that's what I try to keep in mind in this role, that we are a workforce development mission-oriented institution, but at the same time, we have an awful lot of students who come here, get the associate degree, then use a transfer agreement to a 4-year institution to get the bachelor's degree, and then go on to whatever else, whether it's a graduate degree or a medical degree or a law degree.
And you also have so many adults returning.
Correct, yes. 4
campuses, phenomenal adjuncts and faculty who bring a wealth of experience. They don't have to worry about the tenure track. They can bring knowledge and information and passion, and they do.
That I think also draws many of our students. They know that the instructors in the classroom are current or former professionals in that field. So they're learning about the theory, but they're also learning about the practical application of the theory in the real world.
Let's switch gears and talk a little bit about how you've been faring during the pandemic. We're sort of back in quarantine. God knows when things will open up to the point where they were beforehand. How are you managing? I mean, your students commute. So you didn't have to close dorms per se.
Right.
But, you have 4 campuses to manage. What are you doing? How's it going?
It's a challenging environment. I don't think we're navigating anything different or unique than what other folks are navigating. I do believe that it's a time, if you look at the national enrollment trends and you look at our enrollment, we're down a little over 10% right now as compared to last year. Typically when you talk to someone here at Delaware Tech and have an enrollment discussion, that would be a concerning conversation to have, to think that enrollment's down compared to last year by 10% or a little more. But when you look at national trends and see that community college enrollments are down anywhere from 9 to 30%, it provides some context. And you need to remind yourself that community college students tend to work while they're pursuing their education. Many have families. Many are challenged by transportation issues or childcare issues. If they're parents and they have children attending K through 12 education, well, that adds an entire layer of complication to what they're managing at home. So our students are busy. And when we look at the enrollment issue and we reach out to our students the way our student affairs folks have over this past holiday break, we're finding out that our instincts were proven correct. When you're trying to navigate a global pandemic, a lot is going on in everyone's lives. And right now, our students are deciding that they have to take a break. They have to focus on their family. They have to focus on caretaking. They have to focus on managing their home or their job, or both. some of our students struggle with distance education. So some of them have decided, this isn't for me. This distance education is not for me. I'm going to wait until in-person, on-campus classes are back. So when we look at all of that, it's totally understandable. We're focused like lasers on supporting the students that we have. And all of them are heading into the spring semester, and many of them have set the goal for themselves to graduate this May, and we're gonna do everything and anything we can to preserve this semester and preserve this academic year. I think during our prior conversation, I told you that last May we graduated 1,800 students from our 4 different campuses, and they all went out. Many of them went out right into the healthcare sector.
Well, that was my next question, Mark. I have 2 more if you have 2.
Mm-hmm.
Are you feeling the pressure to get those nurses, out there? I've heard conversations nationally,
right,
about accelerating nursing programs because the need for healthcare workers is so tremendous.
Yes, that's right. And at our final chamber board meeting last fall, Dr. Nevin from Christiana Care gave everyone an update, and her message was really, really impactful. She was talking about the fact that, back in the spring, the major concern was equipment and capacity and things like that. And now, the hospitals have the equipment they need, and they're less concerned about capacity, but they're very concerned about people.
Right.
The impact that this pandemic has had on their people. And, we did a job fair back in December for the hospital community, that entire sector. We did a job fair on December 16th. So we're trying to do our part, and it involves not just nursing, but it involves our other allied health programs like patient care technician, respiratory therapy, all of those related fields as well. So we're very focused on that. We're trying to make sure that our nursing and other allied health programs have adequate clinical space so that they can complete those requirements. But we're working very closely with the healthcare sector, and we're doing everything we can to make sure that workforce, that high quality workforce, is available during these very challenging times for everyone.
Final question for you. Looking past the pandemic and the quarantine into 2021, the entire year, anything new on the horizon? Is healthcare going to remain a huge focus? Anything you can share?
Well, I do believe healthcare is going to remain a focus because of that component that Dr. Nevin talked about, and that is, are we going to have a nursing shortage, or are we going to have a shortage in some of these other related allied health areas? The other thing that we're working hard on here, last November, November of 2019, but 18, I received a letter from the 19 school district superintendents asking us for help in addressing the teacher shortage in Delaware as well. So you might remember we created a bachelor degree credential in nursing a few years ago to address that shortage.
I do.
We are now in the process of assessing and developing a response to that request from the superintendents, the 19 school districts. So, I may be coming back and reporting to you on our development of a bachelor degree credential in elementary education, because as the superintendents know, 85 to 90% of our graduates, walk across that stage and they stay right here in Delaware. They stay in the community that they're living in. So we believe that one of the things that might become a priority in the years ahead for us is to make sure that we're responding to the superintendents and the school districts in addressing what used to be a national issue, and that is a teacher shortage, but they are projecting 3 to 5 years down the road a shortage here in Delaware. We want to make sure that we're ready to help them with that.
I am certain you will be, because Del Tech, I'll always call it Del Tech, by the way. I know Delaware Tech is the preferred moniker.
It's, if you look at our media, Del Tech is, you know, if our students and graduates and business leaders call us Del Tech, we're Del Tech as well.
It's true. It's
Yeah.
true. But whatever you call the institution, it's a phenomenal resource for our state, and it continues to grow and evolve. Dr. Mark Brainard, thank you so much. I will check back, wishing you all good things in 2021.
Sharon, thanks so much for your support and for having me. Have a great new year. Stay healthy and safe.
Okay.